Hi everyone, this is Vaibhav Vaidya with the Fits on the Go blog here at the 25th Annual Legislative Conference in Washington, D.C. We're joined today by Dr. Jay Lutz, who's the former governor of ACC from Georgia and also a member of, a charter member of the ACC PAC. Thank you for joining us today.
Thank you very much. It's a pleasure to be here.
Great. Dr. Lutz, can you tell us more about how the Legislative Conference has changed in the 25 years that it's been in existence?
Well, I've been here for probably the last 20 years. And during that time, I sort of think of the changes having occurred sort of in two fronts. First of all was we had a different message when we started off. It was a very educational message, and we were certainly interested in the quality of care that we were producing and the access of care to our patients, but also we were trying to provide an education for our patients, and we thought that if we could interact with the congressman and bring them this same type of an educational message, that it would be good for everybody. Additionally, over the years, then we've sort of broadened our message to include appropriateness criteria and providing excellence at a reasonable cost so we can provide for better outcomes. And I think that that's one of them. The second is the changes in the conference attendees. When we started off, it was sort of all physician, and there were very few of us. And I can generally remember when I went to visit a congressman, it was usually myself, one other person. Now, the Georgia delegation has gone from 2 of us up to about 15 that we're bringing to the 2016 meeting. And in this, we not only have physicians, we have the advanced practice providers, we've got fellows in training. And I think that that helps us broaden our perspectives such that you can learn the problems from a variety of different perspectives, and that makes us a much more effective argument for why we think that the ACC should be providing advice and have a position at the table.
So it's good to learn how much this conference has evolved in the last 25 years. What do you think are the reasons that physicians, and in particular fellows, should attend the legislative conference?
Well, I think particularly I view it as one of 3 O's. One is an opportunity to look at the process and how Washington works and how things that you may wish for your patients or you wish for yourself, how they get brought into effect. The second thing is it's an opportunity to learn and to teach. You're going to interact with people, and you're going to learn a lot when you're here. You need to keep coming. And then the last thing, I think you have an obligation for somebody like me who's been around for so long. You have an obligation to your peers. You have an obligation to the younger people that you want to leave a great profession for that has very noble goals, and you want that to continue.
Wonderful. Well, thank you so much for taking the time to speak with us today.
My pleasure. Thank you very much.
For more videos like this, please go to youtube.com/fitsonthego.